हेलो एवरीवन, आई एम सुब्रतो माझी। मैं वेस्ट बंगाल से हूँ। मैं बी फार्मा का स्टूडेंट हूँ। कुछ साल पहले 2020 में मेरे बाएं पैर पर बहुत सीवियर पेन हुआ था, इसलिए से मैंने मेरा लोकल डॉक्टर के पास ट्रीटमेंट के लिए गया। लेकिन ट्रीटमेंट के बाद मेरा कोई पेन नहीं कम हुआ, इसलिए से मैंने कोलकाता पे ट्रीटमेंट के लिए गया। वहाँ पे मेरे को पता चला कि मेरा एक सीवियर कैंसर है, लाइक बोन कैंसर। तो वो सर ने कुछ ट्रीटमेंट किया, वहाँ पे मैंने 2-3 केमो लिया। उसके बाद मैंने सर्जरी करने के लिए नारायण हॉस्पिटल पे आया। यहाँ से डॉक्टर सुमन सर से मिला। तो सर ने मेरा ट्रीटमेंट के पहले सर ने बोला कुछ टेस्ट करो। तो सर के मुताबिक मैंने कुछ टेस्ट किया, लाइक MRI, CT स्कैन, बोन स्कैन एट्सेट्रा। तो सर ने मेरा सर्जरी किया। तो सर्जरी के बाद मैं पूरी तरह से ठीक हूँ। पहले जैसे मैं चलता था, सीढ़ी पे उठता था, मैं पूरी तरह से फिट हूँ। एंड दिस ऑल क्रेडिट गोज टू सुमन सर एंड हिज टीम। नाउ आई एम वेरी फिट एंड फाइन। थैंक यू।
Mr. Subrato Maji, 21-year-old male, is from Kolkata. He is a diploma pharmacy student. He was diagnosed to have osteosarcoma of his thigh bone, a type of common bone cancer we see in that particular age group. And he had received his chemotherapy at Kolkata, and he had traveled all the way from Kolkata to Bangalore to get the surgery done by me. So we went through his investigation and images, and we decided to do a surgery where we are going to excise his thigh bone and replace with artificial metallic prosthesis. And I explained him about the procedure and functional outcome following the surgery. So the one thing he asked me is whether we'll be able to walk after the surgery, and he told his dream is to visit places and explore new places. So I just smiled at him and said, yes, you can. So we did a surgery where we excised the affected part of the tumor bone and replaced with metallic prosthesis. Soon after surgery, he went back to Kolkata and he completed his remaining chemotherapy. So now he has come back after 3 months for the follow-up, and I am so happy to see his functional outcome. He is able to walk absolutely normally without any pain or limp, and we can't make out that he has undergone such a major surgical procedure where we have replaced 20 to 25% of his normal bone by using artificial metallic bone. And he also told me that he has extended his stay in Karnataka for a week to explore places like Mysore and Coorg, and I am so happy for him. So the message I want to put it here is, cancer is not the end of the life. If you are determined and take proper treatment, we can beat cancer, and you can have a near normal life, and you can chase your dreams. Thank you so much.